The femoral triangle, also known as scarpa's triangle and femoral trigone, is a subfascial space located within the superomedial aspect of the anterior thigh. It appears most prominently as a triangular depression inferior to the inguinal ligament with hip flexion, abduction, and internal rotation. In this video, we shall look at the borders, the contents, and the clinical significance of the femoral triangle. The femoral triangle consists of three borders, a roof and a floor. The roof of the femoral triangle consists of skin, superficial and deep fascia of the thigh, and subcutaneous tissue, with the exception of the saphenous opening where it is formed by the cribriform fascia. The floor of the femoral triangle is formed by the adductor longus, pectineus medially, psoas major, and illiacus muscles laterally. The superior border, which also forms the base of the triangle, is formed by the inguinal ligament, which is a ligament that runs from the anterior superior iliac spine to the pubic tubercle. The medial border is formed by the medial border of the adductor longus muscle, while the rest of adductor longus muscle forms part of the floor of the triangle. The lateral border is formed by the medial border of the sartorius muscle. The apex is formed by the cross between medial and lateral border. Numerous important structures pass through the femoral triangle. The following structures are contained within the femoral triangle from lateral to medial. The femoral nerve innervates the anterior compartment of the thigh and provides sensory branches for the leg and foot. The next structure medial to femoral nerve is the femoral artery, which provides majority of the arterial supply to the lower limb. Medial to the femoral artery lies the femoral vein. The great saphenous vein drains into the femoral vein within the triangle. The femoral canal contains deep lymph nodes and vessels. The femoral artery, vein, and canal are contained within a fascial compartment known as the femoral sheath. The contents of femoral triangle from lateral to medial can easily be remembered by the mnemonic navel. N for the femoral nerve, A for the femoral artery, V for the femoral vein, E for the empty space which is the femoral canal, and L for the lymphatics. The femoral triangle is clinically significant for the following reasons. It provides palpable access to the vital femoral artery. It is a common location for quick vascular access. Venipuncture of the femoral vein in the femoral triangle can be used for venous access when peripheral veins cannot be accessed. In the staging of cancer affecting the inguinal lymphatic drainage, the region of the femoral triangle and its roof, which contains both deep and superficial inguinal lymph nodes, may be the target for lymphadenectomy. A catheter is inserted into the femoral artery or vein for a variety of radiologic operations, including coronary and peripheral angioplasty. Interventional endovascular procedures use catheterization to access the body's numerous important vessels through the femoral artery or vein. Many surgeries that call for access to the femoral vasculature can easily be visualized under ultrasound. Assessment of pain and swelling in this area can be done by palpation or ultrasound. The femoral triangle may be affected by many diseases and pathologies. Femoral hernias can arise below the inguinal ligament and bulge directly into the femoral triangle. This is a weak area in the lower abdominal wall that is prone to femoral hernias. Malignancies can spread within the superficial or deep inguinal lymph nodes and often lead to inguinal lymphadenopathy. The femoral vein is susceptible to deep vein thrombosis. The femoral artery is susceptible to peripheral arterial disease. Following a vascular intervention, femoral triangle hematomas or arteriovenous fistulas may form. And that's all for this video. If this video has been helpful, hit the like button and subscribe to our channel. Thank you for watching. Until next time.